Welcome to the March 26th City Council Policy Session. I would like to call this meeting to order and welcome everyone who is joining us telephonically or online. Councilmember Garcia, do you have a motion related to executive session?
Yes, so I have a motion. Mayor, in accordance with properly posted notice and agenda, I move that the City Council, pursuant to Arizona Revised Statutes, Section 38431.03A, meet in executive session on Monday, March 30th, 2020 at 1 p.m. in the East Conference Room, 12th floor of Phoenix City Hall, 200 West Washington Street, Phoenix, Arizona. In addition, I move to change the start time of the City Council Policy Session currently scheduled for 1 p.m. Monday, March 30th, 2020 to 2 p.m. Monday, March 30th, 2020.
Second.
2:30 p.m.
Thank you. We have a motion from Councilmember Garcia and a second from, I believe, Councilwoman Pastor, and we are confirming that policy would start at 2:30 on Monday, March 30th. All those in favor, please say aye.
Aye. Aye.
Any opposed? Passes unanimously. Thank you so much. This group will reconvene again on Monday. Glad to welcome everyone here. We have a very impressive group of speakers here today, and we're going to begin with updates from two distinguished experts in the field of medicine. At our last council meeting, council members talked about working more closely with our healthcare system and getting a better understanding of what they face as well as what they expect, how we can partner, and really trying to get the best data for us to be able to make decisions as well. We are joined by leaders from Valleywise Health System and the Mayo Clinic. These are both health systems that have been very important partners for the city of Phoenix on economic development, but also health systems that have literally saved the lives of our employees. So thank you. Please give our thanks to all of your employees. We're going to begin today with Dr. Richard Gray, who serves as CEO of Mayo. Thank you so much for lending your time. He is an accomplished physician as well as leader in the healthcare profession. We will also hear from Dr. White, who is the Chief Medical Officer at Valleywise, an extensive background, also highly educated and a lot of experience. So thank you both. You are incredibly busy right now, and we are grateful you are willing to lend your time to the Phoenix City Council. We will begin with Dr. Richard Gray. And Dr. Gray, we cannot hear you right now. Councilmember Garcia.
Mayor, since we're waiting to figure out our technical difficulties, wanted to wish the Vice Mayor a happy birthday publicly, so happy birthday.
Thank you.
And Dr. Gray, if you could unmute on your end, please.
And while we wait for fix the sound, Councilmember DeCiccio, Councilmember Waring, Councilwoman Pastor, Councilwoman Stark, and Councilwoman Williams are all with us telephonically. So thank you for showing us a great example of practicing good social distancing. Dr. Gray is going to reconnect with us so that we can see if we can clear up the connection. Dr. White, could we get a mic test from you?
Certainly. Can you hear me?
We can. How would you feel about calling an audible and being our first presenter?
I would be happy to if you'd like, Mayor. Well, good afternoon, Mayor and members of the City Council. Dr. Michael White, joined by Dr. Richard Gray. On behalf of Valleywise Health, I want to thank you for the invitation to talk this afternoon, talking about, our preparations as health systems and health systems professionals as we prepare and have been seeing COVID-19 within Maricopa County and within the city of Phoenix from this. We as health systems began to truly take notice of the novel coronavirus, COVID-19, when we saw our first case in Arizona back in January. As we saw the information that was coming from China out in December and then started to see these cases in January, we all felt that it was a matter of time before we started to be able to see these cases within the United States and certainly within Phoenix here. As certainly we've seen the spread as it now has become prevalent within our community. We note that Dr. Chris's message to us this morning, a press release, that we're starting to see widespread community spread within this virus. And it's a very easily and transmissible virus. You pick it up by droplets touching, surfaces that somebody may have coughed on, that somebody may have sneezed on, doorknobs, and then touching your eyes, touching your face around that makes this easy to pick up and contract. And you may not have symptoms of this, illness until, somewhere's up of, 4 to 14 days later before you begin to feel ill. And then at that point, you may have already infected others. I commend the work that the City of Phoenix has done about education and about the importance of us, staying distance away from each other, because that distance of 6 feet, that social distancing, helps us not transmit those droplets as we're talking to one another, as we interact with one another, as we go forward from this. Within Valleywise Health, here in the heart of the downtown area of we have seen seen cases that have come in through our emergency department that we're caring for here today. And as we've seen in other parts of the country, we are preparing to be able to take care of that large influx of patients should that occur here within Phoenix. We're converting various areas within our hospitals to be able to take care of more patients and more acutely ill patients if we need, but also providing education to those most vulnerable populations by being able to get the word out for well people to stay home. We'll do your health care through the phone or through some sort of other means to make sure we're meeting your needs. If you're ill, give instructions to the best of our ability. We've actually had our clinicians, as other health systems have, partner to make sure that we're not bringing any elective cases down, to be able to conserve our supplies if we are going to see that spike, and as we will likely see that eventual spike. Our goal through the social distancing, through all of this work, is to be able to, really, flatten that curve. You've heard us say that. Dr. Gray will talk a little bit more about this as well, but flatten that curve a little bit so we don't quickly overwhelm our health systems here within Phoenix. If we are able to keep our distance, as we go through this, hopefully we won't overwhelm our resources and be able to care for each of these patients individually. And with that, I'll hand it to Dr. Gray, who has some slides about some of how this works and through these pandemics.
Thank you, Dr. White. Dr. Gray.
if I can just mute here to make this work. Okay, can you hear me okay now? I apologize. I will try one more time to reconnect.
Dr. Gray, we've at least heard you now.
Okay, can you hear me now?
We can hear you now.
Okay, I will use the phone. I apologize. I'm not sure. We did a test earlier, but I greatly apologize. So, Mayor Gallego, City Council members, thank you for the honor of being here and joining Dr. White. And again, I apologize for the audio difficulties. Are you able to see? I'm going to bring up the slides here, and I will double check to see that. Okay.
We can see the slides.
now showing? Okay. We're making it work. I greatly apologize. So thank you again for the honor of being able to discuss with you some of Mayo Clinic's preparations alongside Valleywise Health and just talk through some of the things as we know it about COVID-19 and how the Phoenix City Council can best help us prepare for what's coming our way. So as Dr. White was just saying, Mayo Clinic, like many other healthcare facilities, has been preparing for COVID-19 for several weeks. Some of the things that I will highlight are that we have a brilliant microbiologist who is able to develop and validate a test that we were able to launch here by March 15th. And we've been able to test over 1,500 patients at Mayo Clinic thus far. That's taken a lot of pressure off the Arizona State Public Health Lab, and we're sharing our expertise with others to try to scale that up around the city and around the state. We likewise stopped non-urgent care, even in advance of the governor's orders, have scaled up our virtual services to meet other patients' needs, and created the surge planning that all of us need to do for this pandemic. We've been working hard to preserve and procure personal protective equipment, PPE. And I would also just highlight that Mayo Clinic, for our hourly employees, has put in a job and salary protection program that guarantees, even in this low work time, when we've taken away a lot of the normal work for our staff, that they will retain their jobs and their full pay through the end of March. So I want to first discuss some of the facts around COVID-19, and there's been a lot of discussion about how dangerous and how contagious is this. And this virus is called SARS-CoV-2. That's the actual virus that causes COVID-19. This chart is not exactly perfect, but it does help to put all of this into context a bit. So the x-axis, going from left to right on this, is the R0, or exactly how infective, how contagious this is. So about how many people can be expected to be infected by one contagious person. The y-axis, going from bottom to top, is the case fatality rate. So how fatal is this disease, at what rate to those that receive it? So as you can see, we should neither overestimate nor underestimate COVID-19. It is not as dangerous as many other things, but it is also more dangerous than many things that we've dealt with. So on that x-axis, you can see that COVID-19 has an R0 rate of about 2.5. So it is, by best estimates, about twice as contagious as the typical season flu. In terms of case fatality, COVID-19 on this chart is probably a little overestimated because it's based on initial Chinese data, but probably the case fatality rate would be best put at about 1%. That sounds very low, but that's about 10 times the rate for the seasonal flu. And that's varied a lot depending on the age group involved. Northern Italy had a much higher average age infected than, say, South Korea, for example. And based on the testing, the more people you test, the more asymptomatic patients you find, the lower the death rate. But I think it's reasonable to put the R naught at about 2.5, to put the fatality rate at about 1%. So that would make it about twice as contagious and about 10 times as deadly as the typical seasonal flu. This represents the publicly reported cases from the Arizona Department of Health Services through yesterday for the cases of COVID-19 in Arizona in light blue, in Maricopa County in dark blue. Please understand, though, that these numbers almost certainly do not reflect the reality of the situation today for several reasons. First, these numbers do lag because of the turnaround times of the tests and because of some of the reporting timelines. Secondly, because of the lack of broad availability of testing, these numbers and the rates at which they rise are much more likely to be associated with the rates of testing rolling out and being available than they are the actual spread rate of the virus. And then finally, many asymptomatic and minimally symptomatic patients probably have not undergone testing. So we do, as Dr. White said, we do have community spread of COVID-19 here in the city of Phoenix, in Maricopa County, in the state of Arizona. And these data are not robust enough to really do excellent modeling. Fortunately, we're not the first ones to deal with this. This has been dealt with in many cities and many countries already, and we know what the pattern looks like and how that can apply to us. So we are continuing to look at some specific modeling as the data becomes more robust at Mayo Clinic. And of course, as Dr. Christ reported last evening, we are likely just a few weeks away from a large wave here that will be a significant test for us. There's been a lot of talk about social distancing. Early in new viral pandemics, we don't have immunizations available to stop the spread of the disease. So non-pharmacologic interventions like social distancing are one of the few tools we have available. So very quickly, the medical goals with social distancing are three things. Number one, delay the timing of the peak of cases. That buys us time for everyone to be able to prepare, particularly the healthcare systems, to be able to get all of their resources in place, get their supply lines, everything ready to go when it does hit. Second, to reduce the size of the epidemic peak. Again, as Dr. White said, if the size of the epidemic peak is too high, it will overwhelm resources and you can't take the best possible care of each patient who does get sick. And then third, to spread the disease over a longer period of time. That allows us to learn more about the disease, trial new drugs, trial new interventions, find the best care so that fewer people die as we learn more over more time. And even as we extend it out to be able to introduce vaccines eventually. So, but also know that social distancing slows the rate of growth in the community to help that peak epidemic also not overwhelm everything else, our businesses, our public services. Imagine all of the grocery store clerks and those that stock the shelves being sick at the exact same time and not being able to keep up with what's needed there. So that piece is not just a healthcare piece. So the goal of social distancing is largely to buy time, but it is not to buy time to just sit and wait. It is to buy time to prepare and to innovate. So our healthcare providers are preparing. They're also innovating with telehealth and other things to be able to better care for people to get through this. Businesses, public services also need time to prepare and to innovate so that they can support the community, support their employees and others as we get through this. So it's important to note also, as demonstrated on this slide, that earlier social distancing leads to greater results down the road. So again, early on, if you go to the second line of this slide, if you have 50% less contact through social distancing, that only cuts the case rate in half. But as you can see, after a longer period, like 30 days, that half that wasn't exposed doesn't expose more people. And so it's basically a logarithmic gain. And so that is why early social distancing can make such a big difference in what the peak case rates look like and how likely it is to overwhelm our systems. So when we talk about, as Dr. White did, about flattening the curve with social distancing, what might that look like? The 1918 influenza pandemic can help illustrate the point. There are a lot of differences between COVID-19 and the 1918 pandemic. I'm not saying that this is a formula or exactly what would happen, but it does illustrate the point. This graph contrasts the social distancing and excess death rate results of two cities during that pandemic. In dark blue with the high peak is Philadelphia. Philadelphia started social distancing late. Weeks after the outbreak was going through their city. Matter of fact, they held a large parade 11 days into the outbreak in the city of Philadelphia. By the time they instituted social distancing, it was too late. They had the high peak. St. Louis had the 1918 pandemic come to them weeks after Philadelphia. They learned from Philadelphia's experience. They put in social distancing 2 days after the outbreak in St. Louis. They left those in place for 6 weeks. And you can see the results in their curve in light blue here. So the peak death rates were 8 times lower in St. Louis. But note, as you look further to the right, the cases went on longer, and there was even a second peak, because once you do take the social distancing interventions away, those that haven't been exposed now get exposed, and people continue to get sick and even die. But cumulatively, over time, St. Louis still had half the excess death rate that Philadelphia did. So if we can achieve in the city of Phoenix a curve that looks much more like this St. Louis curve than the Philadelphia curve, I hope you can see how that can make a difference in being able to effectively have the city function, have our healthcare system function, and take the best possible care of these patients in a difficult time. So again, to deal effectively with this COVID-19 pandemic, it's going to take all of us working together. We are preparing, Mayo Clinic is preparing, Valleywise Health is preparing, many others are preparing, but we need the help of the public and our public officials to be able to make this manageable. This photo is a picture of one of our nurses named Alex during our first day of drive-through COVID testing back on March 15th. He's just one of the courageous healthcare professionals on the front lines of all of this. And our brave doctors and nurses like Alex will much better be able to care for our community if our community helps by staying home to slow down the spread. When this rainbow appeared over our first day's efforts as COVID-19, we took it as a sign of hope and healing, and that we'll all get through this together. So again, thank you for the opportunity, and I will stop sharing here, and I'm sure Dr. White will be happy to answer any questions that you have.
Wonderful, thank you. That was very powerful depiction and good data for us to understand the value of social distancing and what is happening with the virus. We are council members. We are lucky to have these experts here with us, and we'll now open the floor to questions, beginning with our Vice Mayor.
Yeah, thank you. Thank you so much. This is very informative, and it's really great to be able to get all this information. So thank you for that. But my question was, so today I received a call from the United Healthcare Workers Union saying that they urgently are trying to coordinate getting 2 million masks to Arizona hospitals. Have you heard from them regarding this effort? And if not, would it be possible to reach out to them to ensure our healthcare workers are getting all the personal protective equipment that they need to be able to do their job safely?
Yeah, maybe I'll take a run at that first. We're happy to speak to anyone who has this concern. As I'm sure Dr. White will share, our ability to care for our patients is exactly dependent on our ability to care for our staff. And the safety and well-being of our staff is every bit, if not more important than the safety and well-being of our patients. And that personal protective equipment is so important. And that's why we all work with good supply lines, but we appreciate the public support coming from the federal government, from local governments, all of the people that are volunteering to help. I think I get about 15 ideas and suggestions a day on where we can obtain more of the PPE that everyone knows we will need as this wave comes our way. But again, one of the ways that we can preserve the PPE is by having that peak not strike all at the same time. If all of our hospitals, all of our nurses, all of our doctors need PPE all in one big spike, that puts much more stress on the system than if we're able to spread this out a little bit. And then finally, I'll just add that all of us contribute to this. We don't want to overuse in a panic, and certainly both the public and healthcare workers need to know the proper use of the PPE so that we don't overuse it when we don't need to. And things like drive-through testing makes a big difference because we can reuse most of that equipment and just change gloves between individuals that are tested.
Thank you.
And I'll echo right on Dr. Gray's comments as well. You know, that's having that availability to protect our staff so they are here to be able to care for those that are ill is of paramount importance to do that. And a large part of this preparation, you know, and the fact that we are having this time to prepare does give us that opportunity to educate the public, to educate our teams around that proper PPE usage, to be able to make sure we're extending those supplies, make sure we're getting those supplies in reserve. And as Dr. Gray mentioned, we're more than happy to partner with the communities and to be able to have those available to us as we need them, as the supply chain continues to refill.
Yes, because it's my understanding that the union has about 39 million of them, and they are willing to share 2 million of those with hospitals in Arizona. So any coordination that can happen there, I think could be extremely helpful for our hospitals here.
We appreciate that. Thank you.
Mayor,
Councilwoman Stark.
thank you. So I have a question on all these stores that remain open, like the grocery stores. Have they been working with the medical field and ways to ensure that as people shop and the workers in those stores are being protected and they're trying to practice social distancing? And I will tell you, I give credit to Target. I went to Target the other day for senior shopping, and when I first walked in the door, they made me stand 6 feet away from a clerk who was wiping down a cart for me, and then she moved, let me get the cart and move on, and they announced the entire time, probably every 5 minutes, that you need to practice social distancing. But is there some group out there that's helping all these different stores get that kind of information?
Yeah, maybe I'll start, Dr. White. You know, you are citing a terrific, not a high tech, but a terrific example of what I was talking about. Of if we are able to buy time through social distancing, it allows the type of innovation that can allow us to function during this pandemic. Grocery stores have to remain open. People need to get food, and they need to have confidence they can get food and their supplies. But what Target and others have done, like you talked about, to protect older individuals who are at higher risk is an example of not a high-tech innovation, but an innovation nonetheless that allows us to get through this better. So in direct answer to your question, is there a source for that? Yes, the CDC is issuing guidelines for such services that I think has been very, very helpful. And many of these organizations have done a terrific job of adopting these very quickly and, again, allowing us to be better prepared for what we're facing.
And then, Mayor, as a follow-up, I really commend what Target did. And that's not an advertisement for Target. I was just impressed. But what about these smaller stores like beauty salons, nail salons? Are they also getting instructions from the CDC, or are they things that we could do to help?
And I'll take that one, Dr. Gray. So I think it is, these are readily available and online for these instructions to do that. I think, we as healthcare systems, by participating in these forums, answering questions, are able to help direct that message, to be able to reinforce those lessons that are being, given to us by, the experts in this field around the importance of the social distancing, about the importance of keeping those high-touch surfaces clean, wiping things down, washing our hands, avoiding touching our face as we do this. So, we hope that through the media, through these outlets, that we're reaching these smaller businesses, some of these smaller, environments where these interactions occur.
Thank you. I think that's an excellent point, that for our businesses out there, that they might want to go to the CDC website and look for guidelines for their specific industry if you are in an industry that is still operating. Councilmember Garcia.
I guess it's a follow-up to that. As we have to make decisions on to where to intervene, whether it be with city employees or in the public or with businesses and so on, one of the things I've been thinking about is could you give us advice on what our formula could be to make these decisions? The things we've heard is people need to stay 6 feet apart and 10 people to a room. But can you give us a little bit more input on the types of things we need to look at when we're making the decisions of putting in policy or moving things around when we're trying to do something ourselves?
Yeah, maybe I'll go first on that one. I think we all recognize, and I certainly am not short-sighted about the trade-offs that are involved in all of these types of public policy decisions, the disruptions that come with this. What we do know, as signified by what I showed you about early intervention and how 30 days it pays off in terms of social distancing, is that early interventions, and it was also shown in that difference between Philadelphia and St. Louis in 1918, earlier interventions do tend to pay dividends. But nonetheless, we have to weigh the pros and cons of all of this. There are economic and social consequences to all of the decisions that you all are having to make, and we understand that there are a lot of trade-offs there. I think in an ideal world, we would have such broad testing that we would have an exact pulse on what the transmission rate is in the city of Phoenix that would give an idea of whether the current interventions are being effective, and we're seeing that case rate isn't growing at an untoward pace. Unfortunately, because we don't have that kind of broad testing, I think we will have to use very good judgment and advice about where we are, and probably make decisions earlier than feels comfortable, because we will not see the hard data showing an uptick before it's a little bit too late to make those interventions, to make sure that our healthcare systems, our hospitals, our businesses are not overwhelmed. So I guess all I could say is that the guidelines that we're talking about are principles. When you pull those triggers and make them stricter and then make them looser, it is going to be a judgment call, but my advice to you is to do it sooner than you feel comfortable.
And I'll follow on Dr. Gray's comments, and it's in collaboration. We as your health system partners are happy to provide information about what we're seeing, about what we are noticing, and where these trends are within the community. As Dr. Gray notes, one of our bigger hurdles is that lack of widespread testing and being able to test everyone to understand exactly where this are. We can judge by the number of encounters we're seeing and things, but remember, we're encouraging those with relatively mild symptoms to just call us, and we may not be seeing all of the people that may be truly symptomatic. So as Dr. Gray would echo his comments, these are going to be difficult decisions based on hunch, and it's likely going to require earlier intervention.
I, I'm going to make two questions in one just to shorten it up. One, I wanted to know if you had advice on how we can support and be helpful with the homeless population. And then two, for your industry, for the medical industry, is there mental health or other support that's needed or already being given that we could be helpful in?
So I'll start with our certainly a vulnerable and homeless population. That's one of the areas that we have concerns regarding, just because those that live in the shelter environments, in these communal or congregate living environments will be a challenge if the virus were to get into one of those areas. We've been working to be able to expand the space, with some of our homeless sheltering partners, so we can maintain that social distance to the best of our ability to help protect those most vulnerable. Partnering to be able to find safe shelter and alternative locations as we deal through this pandemic would be a great asset for us as a community. With the mental health and the behavioral health piece, we are, starting to see with some of these isolation and some of those social things that there is some anxiety around that. We need to make sure that we provide that support, checking in with those that may be vulnerable, to provide some of that social support via phone as best as we can, and have those resources available. And I'll ask Dr. Gray if he has any other comments on that line.
No, I would agree. And, fortunately and unfortunately, there's so much care that can be deferred, that is being deferred. Certainly at Mayo Clinic it is. And some of that care involves mental health. And so redeploying those mental health professionals from maybe what they would typically do in a day to support some of the individuals and their families that are dealing with COVID-19 or the anxieties around it is going to be extremely important. And here's again where I will advocate for let's not just take the time to only prepare, but we need to innovate as well. So many hospitals and many health systems have had to make the difficult decision to limit or even eliminate most visitors in the hospital. That is very, very difficult on patients in the hospital, whether they have COVID-19 or something else. And so the ability for us to innovate and find ways, it can be as simple as phone, but if we can do video chat capabilities that we can provide to our patients, it can help to alleviate some of that sense of isolation. And we've seen just amazing examples of this, not just within the hospital, but within the community. People purposely being at their windows near each other, opening their windows so they can hear each other. Those kinds of things are going to remain very important as we deal with this. Whether we do formal social distancing or not, as this happens, social distancing is happening, and we've got to find ways to compensate for that so that the mental health aspects don't get ahead of us as well.
Thank you. A good reminder for all of us in this community, we need to be checking on people who are alone and making sure they know that they are not actually alone. Did I interrupt? Go ahead, Councilwoman.
This is Councilwoman Pastor, and I really appreciate all the information and data and the scientific base behind it. One of my questions is that I would like to know how you are working with other cities, counties, and states to help us all get on the same page as to flattening the curve. And so are you doing these type of presentations across the board with different cities that invite you, or with the county and the state?
Yeah, so maybe I'll start and then kick it over to Dr. White. I would say that we are trying to provide our best information to everyone that will listen to us, and we are taking multiple ways to do that. So, of course, I'm at an organization that has a presence in actually four different states, counting Wisconsin. And we have been in close contact as much as we can with public officials that are having to make the difficult decisions that all of you are having to make to provide our best counsel and understanding of all of the trade-offs that they're facing. So we are doing that through direct conversations. We are also trying to provide information to the public. So through media interviews, through multiple states and national and international means. And then we're doing written communication as well to multiple outlets, both again for publications, media publications, but public health officials, and then just other organizations and information sharing and trying to help each other. Like I said, our blessing in Arizona is we're not the first hotspot in the country. We're not the first hotspot in the world. And we need to take advantage of that and learn the lessons of what works, what doesn't work, and how we can stay ahead of it.
And I would absolutely agree with Dr. Gray. We're happy to communicate and have been communicating with those, that we can have the most influence, whether it is within, especially here within Maricopa County, within the state of Arizona, having these very frank and same conversations, presenting this same type of data to these individuals as you all are, making these decisions to do our best information that we have to date. And continually refining that as we learn more and more information, as we see what's going on in California, what's going on in New York, how we can use the lessons that they're learning there to better prepare ourselves and hopefully be able to do a great job of responding to the needs of our constituents.
And I would just add that the other piece of this is sharing among each other. So Dr. White and the CMOs from multiple healthcare organizations, they are on regular phone calls, learning from each other, helping each other to get this up in our community. I mentioned our brilliant microbiologist who made and validated a test. We're working with scientists, for example, at ASU, so that they can use their scientific prowess and, importantly, their resources in terms of the machines they have to run these types of tests to give them the test so that they can get it up and running. They're hoping to get to a point where they can do 4,000 tests a day through the stadium in Tempe. And so again, I think all of us are really coming together, not just to share information with public policymakers, but with each other, with other allies that can make a difference in all of this.
Mayor?
Councilman DeCiccio.
One of the things I'd like to discuss, if at all possible, and it's, still right now, it's still a guessing game because so few people have been tested, but there are discussions going on nationally now that we're going to hit another wave starting in September or October. And can you explain a little bit more about that so that the public kind of understands a little bit about that? And so if we hit this other wave, what does that mean? To whoever wants to answer that.
Yeah, so I'll start with that. I think you're right. This is based on some judgment of what we're likely to face. We don't yet know whether COVID-19 or SARS-CoV-2 has some seasonal aspects to it, like we see with the seasonal influenza, with the seasonal flu. We do know that in some regions, as the temperatures have warmed up, we haven't seen big changes. So that does at least give some warning that we can't just count on summertime making a difference. I think that this discussion of a second wave, a lot of it has to do with some of what I was talking about. If we flatten the curve and therefore make fewer people get exposed to it early on, that does make for more people who have not developed immunity who might be exposed at a later time period. So again, we try to learn from past experience. H1N1, we know that after an initial wave, a little bit of quieting in the summer, we saw it come up again going into the fall and winter. And certainly that's a possibility with SARS-CoV-2 or COVID-19. But again, our hope is that in doing so, the further we push those cases out, the better we will have refined our care, the better we will be prepared to take care of those patients, and the closer we get to being able to have an immunization available.
So I think the best, personally, and I am not a doctor and I don't try to pretend to be one or a medical expert, but if we look at the 1918 Spanish flu that went through, and if you take your Philadelphia and St. Louis case, and I was looking at your chart, it's very impressive. I mean, but what I remember about that is that the same amount of people ended up getting the same disease, ended up getting the Spanish flu. But what it did is allowed the healthcare industry in St. Louis to catch up, and that's why you had fewer deaths occur. But you still had significant amount of deaths. Is that what happened back then? If you look at by flattening the curve, did it just extend it out? Did they have another wave, or did they not have one in Philadelphia?
If you look at that data, and you look at that Spanish flu data, they did have a small bump in St. Louis again in the later months through that when some of the social distancing relaxed, some of those restrictions relaxed. In there, they saw a small bump, but as you recognize, they did not overwhelm the system all at once. And therefore, the overall, death rate in St. Louis was actually lower than in Philadelphia because they didn't overwhelm the resources all at one time.
But roughly the same number of individuals ended up getting it, did they not? I don't know enough about it, so I'm just asking.
Yeah, when you look at some of these, especially back when we weren't able to develop vaccines, eventually it has to work through the communities until you develop what people call herd immunity. Enough people have been exposed that are not, i.e. the number of people that get infected by a person who is contagious, gets to 1 or below. You get there by either continuing social distancing indefinitely, which isn't possible or isn't advisable at least, by getting herd immunity, or by getting to the point where you can vaccinate. So in more recent times, what has happened is if you are successful flattening the curve, and I don't pretend to say that this is easy. Those curves that I showed are remarkable differences. Those are some of the biggest contrasts that are out there in the literature. In many cases, social distancing hasn't been as successful. But if we are successful with social distancing in the modern era, one of the hopes is not just that we don't overwhelm the system, overwhelm businesses, overwhelm all of our services, but that we continue to push some of those people out to where we have better treatments. So yes, just as many get it in that case, but fewer die. We get the good care, so fewer die. But also, eventually, we do get to an immunization, and then we can stop it at that point, and fewer people ultimately have to face it. So that is a difference in the modern era.
I get it. So let me ask you then, too, the coordination is critical between all levels for state, county, hospitals, and then from our end of it, the local government. What could we be doing right now to be helping you? I mean, one of the things that we talked about with the city manager was the opening of St. Luke's, using that either for intensive care or moving the COVID-19 individuals there. I don't know. I mean, from our end, or even the convention plaza, is there anything that you see in our horizon that we can plan for the worst case scenario to be prepared for, that we're helping the hospital industry?
I'll let you start, Dr. Gray, and then I'll go on after that.
Okay. Yeah, I think the best thing that we can do is have good communication. The best thing we can do is talk to the public, make sure everybody's taking it seriously without panicking, but to then acknowledge that based on the successfulness of all of those things, there is still a wide range of possibilities of what that curve looks like. And we won't know it until it starts to actually occur, because it will happen quickly once it accelerates. And so I think because of that wide range, the more scenario planning that we can do, that includes some of that worst case scenario planning like you discussed. Okay, what other places can we repurpose and staff in a safe way that could care for patients if we have significant overflow from our existing healthcare facilities? What can we help creatively in terms of breaking down barriers and regulations to allow more flexibility to get there? I do think that that kind of scenario planning is very important, and it's much easier to have all of those worst case scenarios in place and not have to use them than to suddenly need them and not have them ready to go.
So you have a very willing council here, mayor and council, that want to do everything they can to help you. And we're not looking at financial numbers. It's not a cost issue for us. So from our end, whatever it takes that you need, the financial resources or whatever you need from us, you need to let us know what that is. You know what I mean? You have to let us know. Otherwise, we're not going to be there. So you have the political side, you have the administrative side, but the political side is 100% behind you, and you need to let us know what it is you need. Can you provide something to us that of what you're going to need in the next day or two so that we can begin those discussions, regardless of the financial cost? I mean, obviously, we're going to look at that end of it, but we need to know what your wish list is from us. Do you think you could put something together in the next few days of what you're going to need from us?
Mayor Gagan, members of the council, I certainly think we can. We can collaborate with amongst us as health system partners, that work within Phoenix to be able to help educate you all about what those wish list items might be and about where we think we need to go as an industry.
And where we can help prepare. I mean, not only just on the financial end, but also on the regulatory end, or what you need from us to be able to cut some corners. That's the wrong way to phrase it. But things that we can help expedite for you. So let's say, example, if you're going to take St. Luke, you may need certain requirements done from the government end of it. We need to know that too.
Certainly, absolutely.
So if you could put that wish list together and send it to each of the council members, then we can begin a real discussion of what we can do to help you as an entity and to help the industry and help our public.
Thank you so much for that offer. Like you said, we're in this together, and I think rather than coming up with a wish list from the top of our heads, as Dr. White said, we do have a forum where we're all sharing together, and I think that's a great forum for us to think about what is most effectively tackled at the City of Phoenix level and following up with you on that.
Exactly. Thank you so much for doing that, and thank you, and many prayers. I mean, the individuals working in the healthcare industry are our angels. They're out there protecting us, and we need to be there protecting them too. But at the same time, we need to acknowledge how hard it is for them and how hard it is for their families and how scared some of them may be. So if you're missing certain things that you need to have available, you need to let us know, because we are there for them. They're there for us. We should be there for them.
Thank you very much for that, and we will certainly convey your support to the teams.
Any additional questions on the phone? We later today are going to hear from our very hardworking economic development team who's been reaching out to our business community, and they have stepped up and said that they have manufacturing capability on a wide variety of products. So we've seen really cool reports of distillers and brewers who are now making sanitizer. We've heard from companies that can, I think, retool to make masks. We even have some who have offered if we can help them with guidance to help with ventilators, probably later on, but if you have a wish list for the companies in Phoenix, I think they want to be there and have your back.
Thank you very much.
It has been amazing to see the generous spirit and the ingenuity of Phoenicians and people all over America and actually all over the world responding to help each other. The way that people have connected and made those kinds of offers, even though some of them to be honest, aren't going to be helpful. It is so wonderful to see, and I think Dr. White would agree with me that we sensed that from you, Mayor, and the council today as well, and we're so appreciative of that kind of support and unity.
Wonderful. Well, in closing, there are some members of the media who are covering this council meeting. If there was one story you'd like to see them write, or one message you'd like to give to the people of Phoenix, do you have a closing message for either of you? Or both?
You know, our message would be, you know, we recognize the challenges of social distancing. We recognize the challenges of staying home, maintaining those distances, not being able to do some of those things activities that you would like. Having this, you know, done now will really help us not overwhelm the resources, not put all of healthcare and all operations at significant risk if we were to get a sudden, you know, an unmanageable surge of ill individuals all at once. We recognize the commitment of everyone. We appreciate that, and we thank their support as we go forward. Dr. Gray?
I would agree with that, and I think I would echo that what I would love to continue to see is that we are encouraging people to be selfless. So social distancing is a selfless act. It may help you, but it certainly will help others. But there are so many other selfless acts going on right now. We see it with our Mayo Clinic medical students volunteering to watch the children that are out of school for some of our staff members that need to work, organizing drives to collect PPE and distribute it to those that are in most need. Like I think, Mayor, you mentioned earlier, to go out and make sure that those that are at risk because of health conditions or their age or are in vulnerable populations, that they're getting the assistance they need in this difficult time. So if I could ask for anything to be messaged, it's think, how can we be united and selfless? How can we serve each other in this time? Because if there's any time we need it, it's at times like this.
Inspirational words from you both. Thank you so much for lending us your expertise and for all that you are doing to create a healthier community. We are grateful for your time and your service to Phoenix and wish you the absolute best in the difficult times to come.
Thank you.
Thank you, Mayor. Thank you, council members.
And we will do our best here in Phoenix to be more like St. Louis and less like Philadelphia and try to flatten that curve. Thank you. We will next move to an update on City Incident Command Response from our Assistant City Manager, Milton Dehoney.
Thank you, Mayor. Good afternoon, Mayor, members of council. So I'd like to start with mentioning that we have created a city employee health update page. And on that page, we contain several frequently asked questions or FAQs. They can access one of the 3 podcasts that have been made to date by either the city manager and or the director of human resources. We list preventative measures that individuals can take to help prevent the spread of the disease. And we also have linkages on that page for local, state, and federal updates. So it's just an additional way of us sharing information with our workforce in order to try to keep them safe. Our stats for today, as of this morning, we have 508 cases in the state of Arizona, 299 in Maricopa County. We have had 8 deaths in the state, with half of them being in Maricopa County. Yesterday, our fire department transported 12 individuals for COVID-19 related illnesses, which is down from the previous couple of days. And last night, we only had 2 police runs for social gathering violations of the emergency order, which would seem to indicate that more people are catching on to what is being expected of them. We had 13 cases yesterday where, thanks to the questioning of the dispatcher about the condition of the person, gave police officers advance notice that they needed to put on their protective gear when they got to a scene and needed to engage with an individual. So we saw that as a plus. We want to say thank you publicly to the semiconductor company who donated 5,000 masks today to our first responders. They made that donation at the donation center that has been set up. We continue to have embedded in our messaging out to the public that we're asking for people to do welfare checks on their neighbors. If you have neighbors that you have not seen and you normally see them, we're asking that you reach out and make sure that they are okay. We continue to maintain connectivity to the regional hospital system. There is a dashboard that monitors real-time hospital status, and we monitor that by our public health liaison and the Phoenix Fire Regional Dispatch Center 24 hours a day. So that lets us know if any hospital is reaching capacity. The information that we glean from that dashboard is reflective of Banner, Dignity, Abrazo, Valleywise, and Honor Health. In addition to the dashboard, we are also communicating more frequently, both in person and telephonically, with each of the hospital systems so that we can keep up with what they might need from us. In terms of our day camps, which we activated on Monday, we are seeing a slow but steady increase in the utilization of those. You will recall I indicated we have 9 different sites around the city. For the first few days, we were only having around 11 kids show up. Then it jumped to 17. As of this morning, it surpassed 50. So that's a slow growth, but I think a signal that more people are deciding to take advantage of those. We do have an internal work team that is looking across the government to determine how we might increase our use of telework amongst the employees. And so we hope to work through some internal issues to broaden the number of people that have the ability to telework. And then we are also working on a document to address a lot of the random questions that were posed by members of this council toward the end of the last meeting. So we need a few days to round all that up. We'll put it in a singular document and then give it to you. Hopefully you noticed in the media this morning the attention given to our housing department. Their staff has been organizing food delivery services for seniors, much needed, and another example of the service that the men and women who work here are providing. We are continuously updating our information and procedures based on information that we get from the healthcare professionals, and that's the snapshot that I have for you today.
Thank you. We will next go to a budget and financial update, and our city manager, Ed Zerker, will begin.
Thank you, Mayor, members of the council. So the budget item today is the beginning of a series we're going to be bringing you in the next few meetings on our budget and financial situation as a result of the COVID-19 pandemic. I will tell you, I have been with the city for 27 years, and I have not seen something move this quickly in terms of our budget and financial situation. So we're all kind of working on new territory together. So we're going to do our best to keep you apprised of what's going on here as we kind of in real time figure some things out. So Deputy City Manager Jeff Barton and our Chief Financial Officer Denise Olson over the next few meetings will be bringing forward information as they put it together. You're going to see charts and graphs and data and have some policy discussions, but I wanted to start actually with a different kind of visual that can perhaps resonate with what we are all seeing on a daily basis and hearing and feeling in the last few days, is an illustration of what we think is the impact on our economy from the pandemic. So this is a picture last spring at Phoenix Sky Harbor International Airport Terminal 4 at the check-in and ticketing counter level. This is a group of folks there who are trying to queue into American Airlines. This is a typical March at Phoenix Sky Harbor International Airport. You'll hear later from our director on that, Jim Bennett. But yesterday I took a walk with Jim Bennett through Terminal 4 because I wanted to see for myself what our employees are working in and what we're seeing out there. And this is what this same level looked like yesterday at Phoenix Sky Harbor, at what should have been the peak of the afternoon bank of flights. So what this means is we have to rethink our budget, and for now and for 2021. So as Jeff's going to describe to you some actions that we have taken administratively immediately is to freeze hiring and really slow down spending to address this year. And we believe that we can manage this current year. But what we need to talk about today is what we're going to do with our budget adoption. So this budget adoption calendar really shows you how fast the world's changed as it relates to our budget development. So 2 weeks ago, we released a trial budget, and that had $28 million of projected additional revenue that we were going to be able to allocate, and Jeff will describe that more to you. By March 20th, the local emergency had been declared, and today we're here to talk about what might be changing with our budget status. According to our original schedule, we would be taking that trial budget out to the community starting next next Thursday, April 2nd, for 3 weeks. But what I'll tell you is I believe we need to cancel those budget hearings, both because of the social distancing and gathering guidelines, but also because that trial budget that we proposed to you doesn't make sense any longer. So I've talked with many of you, and I think we're going to try and put together some more virtual things that we'd like to do. After we present a revised trial budget, it's probably more like a week from now on April the 9th. And then based on where we get to between that next week, April 13th, through about 10 days, figure out some different ways to do virtual budget engagement using our online tools. I've had a lot of good suggestions about maybe teletown halls and virtual Facebook Live and some different things. We'll work on those together. We don't have answers today. So that by April the 30th, we can release a proposed budget, because we get into our state required and charter required adoption calendar, which says that by May the 19th, the council needs to adopt a tentative budget so that the June and July formal adoption processes can happen. So we're going to be working quickly. Jeff and his team have been working virtually, not virtually working, they're working virtually on this, as has Denise and her financial team, and all of our departments are starting that up. So we want to talk to you a little bit about that, but start today with because we don't have a lot of immediate data, start with what we know about the economy. So I'm going to turn this over to our Deputy City Manager and Budget Director, Jeff Barton, and then we'd be happy to take questions and have dialogue with you about next steps. Jeff?
Mayor, members of the council, good afternoon, and I'm just going to jump right in. We find ourselves in the midst of an economic crisis that appears to be a global crisis as well as a pandemic. So over the last 3 weeks, we've had a lot of turbulence from an economy standpoint as well as the pandemic of the COVID virus. So I want to rewind. Just 3 weeks ago, we sat here and presented to you a 5-year forecast that we were really excited about. You know, we were structurally balanced. We were being fairly conservative with our revenue growth despite what we were seeing year to date. And we identified a surplus projected for next fiscal year of $28 million. 9 days later, we came back to you and released our trial budget, which showed how we were going to spend that $28 million surplus on some of the programs and services enhancements that you've been talking about for the better part of the last year. However, in the midst of all that, starting back in February 20th, between then and March 24th, the stock market crashed. Not just a normal crash, it was big. We've lost over 8,600 points as of Tuesday. Now, if you subtract Tuesday's 2,000-point gain, you're at about 10,000-point loss. What does that mean to the average person? Well, according to S&P, during that 3-week period, we've lost over $5.3 trillion in wealth in the stock market. $5.3 trillion. We've lost all of the past 3 years' worth of market gains. And also, during that same period of time, the stock market has set 3 records, March 9th, March 12th, and March 16th, for the 3 worst days in market history, all in those 3 weeks. We also, last week, the state had issues with their website. 30,000 Arizonans applied for unemployment insurance. That's the most in 1 week since 2009, which was back to the Great Recession. The interesting thing, again, we don't find ourselves here alone. The information that I talked about with you back on our 5-year forecast in good position, we find many other cities that are adopting their budgets in the same process. They thought they had a surplus to only find out 3 weeks later that they probably have a deficit. Those unemployment benefits that we talked about with Arizona, we're also not alone there. If you look at this chart, this is a chart from Bloomberg, and it shows that we have had over 3.2 million unemployment claims as a result of COVID. That's significantly higher than what we've ever seen in the past. So again, this is not just Phoenix, this is across the entire country. In fact, if you want to put a finer point on this, you do a simple Google search on coronavirus and local sales tax, and what you'll see are countless articles, headlines across the country, talking about how it's going to devastate cities, businesses, with the loss in revenue. New York talking about $3.2 billion. Seattle over $110 million. So again, this is not just something that Phoenix is dealing with. We are all dealing with this. If you read some of these articles, you'll see that many of these cities that are facing these problems, just 3 weeks ago, they were also projecting surpluses. So this is not just a Phoenix problem. What is the economic outlook? Again, is this the opening act, or do we have more to follow? We really don't know. And if you ask 5 economists, you get 5 different answers in terms of how severe is this going to be, how long is it going to be, and how long is the actual recovery going to be. No one really knows. What I do know is that most cities, like Phoenix, a large portion of their revenue stream comes from sales tax. Sales tax is going to be heavily affected as a result of the economy as well as the COVID-19 pandemic. We also know that all cities, like Phoenix, we have this 2-month delay that the city manager discussed with you last Friday in his budgetary remarks. What happens in January, we don't get that information until this month. So again, there's a 2-month lag with sales tax collections, activity collections, and reporting. So we won't know what the impact of this thing has been until May or June. But we do know, based on 9/11 and the Great Recession, we have some anecdotal information that we can apply. So again, putting this into perspective of current year, so here's the budget this year, $4.5 billion in resources, almost spread evenly in thirds. The general fund's about 31%, which provides all the service for our day-to-day operations, police, fire, parks, library. We also have special revenue funds that are about 36%. Those would be things like AHR, the Arizona Highway User Revenue Fund, Development Services, and the Police and Fire Specialty Funds. And we also have our enterprise funds, which would be Aviation, which you'll hear about a little bit later with Jim Bennett, water, wastewater, convention center, and solid waste. What I want to do now is focus on the general fund, that 31%. So when we go into the general fund and we start looking at our revenues for this year, we've got about almost $1.3 billion in revenues. Roughly 40% of that comes from local sales tax and other fees. We've got another 36% from state shared revenues. Property tax is about $170 million, or 13%, and we have user fees of about $133 million. So when we really dive deeper into the local sales taxes and related fees, that's about $505 million of that total amount. The largest chunk or section of that is retail sales. So those retail sales are every time we buy something, you're paying sales tax. And then we've got various leases and rentals, utility and franchise, tourism, contracting, and other. But again, you can see the lion's share of this comes from that retail category, which will be heavily influenced by what's going on right now. Then we move over to state shared revenues. And as you can see from this chart, we've got roughly 37% comes from state sales tax. Then we've got income tax. And again, the thing to remember about income tax, we flash back to that job loss report. Income tax is shared with cities and towns 2 years in arrears. So all the job losses that we have this year, we will not feel that this year, we won't feel it next year. We'll feel it in 21, 22. So even if we've recovered by then, we still have another blip to deal with 2 years later. And then we've got vehicle license tax, which are about 17%. So looking at state-shared revenue sales tax, 173 million of that $463 million total, almost 63% coming from retail. Entertainment, roughly 20, which is also, tourism entertainment also includes our hotel, motel, restaurant, and bar revenues, and amusements. Contracting, utilities, and other rentals, you can follow that. The lion's share being retail. So what does all this mean? But again, when I boil this down and we look at the two major categories being retail, sales, tourism, and entertainment, those are the two largest categories within city sales and state sales. They account for roughly $400 million or 30% of our total general fund revenue. Both are extremely volatile during a downturn. They're even more volatile during this downturn because it appears like they're heavily influenced by COVID, which is requiring across the country shelter in place, bars to close, restaurants to close. So we're seeing not just a slowdown, we're seeing almost zero activity in those categories. So if we lost 10 to 20% of that revenue, that would be between $40 and $80 million. To put that in perspective, during the Great Recession, which was not even related to restaurants and bars, it was more of a household, home values and contracting. During the Great Recession, we lost between 12 and 17% in those categories. So again, just kind of keep that into perspective. So then we move on to more stable side of our revenue stream, which is property tax. So we've got roughly $171 million in property tax. Again, we levy that property tax based on state statute and city charter. Those collections are expected to increase next year based on home values. And again, we don't think right now that if there is impairment that it would hit us next fiscal year in this category. Probably would be 21, 22. And then we have user fees, which are roughly $133 million. The big piece here is fire with ETS revenue, or the ambulance billing revenue. Then we have other services. And then we have police, which really it accounts for things like working after hours at sporting events and things of that nature. We've got fines and forfeitures in the court, which we also know is going to be impacted during this time as the court has really slowed down its operations. And we got cable communications, and then other things like parks, library fees, and streets fees, and things of that nature that make up this category. So again, ahead is a lot of uncertainty because it's really too early for us to really know anything. The results on our sales tax implications won't be known until May and June. The first time I'll see any of this is in May, and that really will only be for the last 2 weeks of this month, which is when this really took place, right? The impact, though, we do believe is going to be significant. I think it's fair to say that right now we know we have to reduce spending. We also have to reduce our revenues. And we also know that there is no general fund surplus. And more than likely, there is a deficit that we'll be dealing with. Again, we're not anticipating, we don't know how long the length of this thing is going to be. We'll continue to work with and rely on the economists that we work with on a daily basis. And the pension impact, which I believe was also discussed a little bit last week, we really won't know the impact of that either until the June 30th number, because that's what the actuarial reports are based on. And the other thing to remember about the pension is it will not impact us in next fiscal year. It will be in fiscal year 21-22, based on the way the actuarial reports work. So looking ahead, we're going to continue monitoring our revenues. We're going to control expenditures where we can and slow those down. And we are going to come back to you about a week from now with 4 different scenarios. We're going to model these scenarios based on what we learned from 9/11, from what we learned from the Great Recession, as well as working with those other economists that we work with and watch and listen to, plus some anecdotal information that we've gotten from other cities who've been dealing with us a little bit longer than we have, like Seattle, like New York. And so with that, I'd be happy to answer any questions that you may have.
Thank you. Really appreciate this analysis. And 4 scenarios is going to take a lot of work, but that will help us make data-informed decisions. So thank you for putting the time into that. Councilmember Garcia.
Thank you for that, and I hope you didn't get offended by the Philadelphia comment earlier.
That was rough, but I'm okay. I'm a Phoenician now.
I'm a graduate of the university, so.
So you could do that. No, what I want to see also added would be other places, other revenue, other funds that we can tap into that maybe we weren't. I know there's a rainy day fund. I know there's assets that we have, and there's also, I don't put this out there too much, but there's other taxes that are specifically for certain things like sporting, like the money that was used for the Suns last year, and I guess this is a question to Ed. If we need to tap into those things, what does that look like, and what do we need to do?
Mayor, Councilman Garcia, yes, that will be part of the analysis that Jeff and Denise will do in terms of ways to plug any budgetary hole. We will look at some of those one-time resources that you talked about. In the last 2009, 2010, there were really three areas that we looked at, which was new revenues, reduced programs, which means reduced spending, and then employees. And so those three things together are sort of where you get a plan put together. And so the things you mentioned would be part of that analysis.
Mayor?
Councilman DeCiccio?
One of the things, and this is way too early to tell because the bill just got passed through the congressional side of it and awaiting the signature of the president, but we ought to be also, taking into consideration that a lot of the money, if not all of it, is going to be that we've lost, is going to be covered by the federal government, which is still us. But at the end of the day, we ought to be able to at least look at that and see where we're going to be. And that would allow us to at least get an idea of what we expect, Jeff. So when you put your prognosis together, you've got to put in there what we expect to get back from the federal government, at least an idea. Otherwise, we're not going to be able to see the whole picture.
Councilman DeCiccio, you are correct. We will look at that and take that into consideration as we build those models. We do know, and you'll hear later in the presentation from Mr. Bennett at the airport, they have an idea on how much of those federal monies will flow to the airport. I think the jury is still out on where those other funds will be coming into the city and in what capacity. But again, as we know that information, we'll continue to work with it. We'll continue to monitor this throughout the budget adoption process. I think one thing to remember, the 4 scenarios that we're building are just based on the information that we know currently. I think this is going to be a very fluid process, and so we will be kind of tweaking that as we go along, and we'll probably have regular check-ins with you throughout this adoption process.
You're absolutely correct. It's way too early to tell anything right now. I mean, we're just not there. But we will soon start getting an idea, and then once we do, Jeff, if you don't mind putting those numbers into the model, that would be great and be very helpful to all of us.
Definitely.
Vice Mayor.
The only thing I would add to all of this, like given the 2 presentations that were just given to us and how we're gonna flatten the curve and how we're gonna move things forward as a city, I think that we should be trying to allocate funds wherever we need to making sure that if we need to have people stay home, that we're able to take care of those folks. Because I think as much as we want people to come into work, we understand that in order for us to flatten the curve, we might need to start asking people to stay home, and we just have to come in with that mentality as we're tweaking the budget. Where is it that we actually have to allocate resources and how we make that stuff happen. But thank you so much for the great work.
Councilman Nowakowski. We'll go to Councilman Nowakowski and then Councilman Waring.
I know this is pretty soon right now because the president just signed the bill for the Family First, the Virus Response to Employees, right, Act. So can we start looking into that? I know that it just happened. We need some time. So maybe in the near future, you can report that back to us. Also, for those individuals that aren't able to come to work, that are basically sent home, but they don't have computers or laptops available, how does that affect them too? So those are kind of questions that are being popped up right now. And if we can have that for the near future, I think on Monday or whenever our next meeting is, so we can answer that to some of our employees that are asking how they can benefit from that.
Councilman Waring.
Thank you. So just a couple things that have already been done. Ed, you and I have talked about this a little bit, and I don't know that you have definitive answers on one of them. Like the library, keeping the libraries closed, is that a cost savings? I mean, we're still paying the employees. We're a very labor-intensive operation as a city, certainly in our general fund. You said probably there wouldn't be a lot of, we don't want the libraries to be closed, obviously, but you've got to be running them, but they are closed. Does that save a lot of money? It seemed like the answer was no. But what about something else that, I talked about, I think other members did too, like Mario yesterday, not running as many bus routes. So in talking to Mario, and I don't want to put words in his mouth, but it sounded like we do save money. We have contracts to run those routes, and you can go into more detail if you want. But the point is we're running less, so we're paying less. Are we going to get estimates of like how much that saves and how much stuff like that can we do? Not stuff that we don't want to do, but stuff that, maybe we can't do, or if you're running an empty bus line, that doesn't make a lot of sense. How much does stuff like that save to help offset, our deficit here? Does anybody have any idea, or is that something you're analyzing?
Mayor, Councilman Waring, those are really good questions, and they really point out an important fact about our budget, and you actually said it in your question, which is the majority of our costs at the city are for people. So in the example of the library that you brought up, when we're paying our staff, even if the building is closed, the vast majority of our library expense continues. We would have some marginal savings for heating and cooling of the buildings and that sort of thing. But basically, as long as we're paying staff, then our expenses continue at about their same level as we have before. And that has been our commitment, is to keep paying our staff right now during this downturn. You mentioned the bus lines. So that's a good illustration of where we have a contract for service. So yes, definitely, if we reduce the level of bus service, meaning we run fewer bus trips, we will be charged less by our contractor. What that does, though, is it flows through to the contractor's employees, who would have less work, and it would be up to the contractor whether they would pay those employees or not. So those two services, library and transit, actually illustrate kind of two parts of how we deliver service and where those expenses are in our delivery.
And Mayor, so Ed, you did mention an issue that I did talk about with Mario yesterday. I guess the contract with the bus guys, I think that was 2015. We redid it. Long story, don't need to bore everybody, but some of the members weren't here for that. So we are now doing, my understanding, more bus service than was originally anticipated or budgeted for in those contracts. So they're making more money by running more buses than I think we had originally anticipated. And this is my recollection, if Mario was there, or you want to correct what I'm saying, but I think that's accurate. So if we scale back, they don't necessarily go out of business, but it also has the effect of, at some point, if we scale back too much with our contractors, they're going to be letting employees go. And at some point, they're not going to want to contract with us. We just went through that with Republic Services. At some point, it behooves them to buy their way out of their contract to recycle if we're not paying enough to them to have it make sense. So we don't want to be, penny wise, pound foolish. I assume you guys are analyzing those kind of things and working with the contractors on basic services. I would argue the bus is a basic service. That's something we need to keep doing, but obviously we don't need to do it if some of the buses are empty. But in the long term, we got to make it make sense that our partners in this, the contractors, don't have incentive to walk away either. Just want to address that. And so, how are we handling that tricky dynamic?
Mayor, Councilman Waring, this is Mario Paniagua. Thank you for your question. Really good questions. And just as you and I had discussed previously on the contract, one of the contracts, the major contract that we've got out there for our bus operations, was done in 2015, like you said. And initially, at that point, as it was bid, it didn't have as much service as there is today. The increased service came about as a result of the Transportation 2050 plan that was approved by voters. Additional bus service was implemented at that time. And so at this point, we did talk about scaling back on some of the bus service, the commuter bus service. and we're looking at doing that. Even with that change, we would still be above where that contract initially was. And so just to confirm what you and I discussed on that. And we continue to monitor that closely, both the ridership as well as the workforce levels for the bus contract. And we're going to continue to do that analysis. And we do that in conjunction, to your point, with the operators themselves, the contractors, and making sure those discussions are happening as we go. So that's not something that staff is doing independently of discussing with the contractors as well.
Thank you. And Mayor, if I could just follow up on that. So that, like, contracts like that are different than the libraries. We can save some money there without really injuring our partners to the point where they want to either walk away or what have you, and then we got to start all over again from scratch. Are there other areas where we can do that, where we can save some money for services that aren't being as utilized with this new social distancing paradigm? And you don't have to have an answer right now, or unless Ed's got a few in mind. Are there places we can save money? Because now is the time, before it's already a crisis, but I mean, our budget situation, we have at least a little bit of time to work on this. I would argue this is sort of akin to, looking for change in your sofa. I assume you're doing now, but just if you have examples, that would be great. Councilman Garcia mentioned some of the funds, like the Sun Stadium Fund. We had that was much discussed last year, but now it's committed, correct? I mean, funds like that, the money's already being spent. I assume there's not a whole lot of wiggle room. I think that one was a little bit different, but they're doing construction on the stadium now. So how would we tap into something where we need the money for a project that's ongoing? Whatever any of us thought about it, obviously I voted no, but whatever anybody thought about it a year ago, that's done now. That discussion was a year ago and it's over. Am I missing something there, or are there other funds where maybe there's a way to tap into it, Ed?
Councilman, you raise a good point. So we have some funds like, as you mentioned, the Arena Fund, where we have contractually obligated ourselves to things. Similar things in the water department and capital. And generally speaking, we don't want to stop capital projects where we already have the funding in place, because that would compound the economic impact. So Mr. Bennett's going to talk to you about the numbers at the airport of those capital projects, and those translate into jobs. But part of the analysis that Jeff and his team and Denise and her team have to do in the next 2 weeks is to go through the proverbial cushions to find the change. I'll just give you an example of that. So for example, we have been, at the council's direction, selling underused or unused land that the city has owned since the last downturn. We've accumulated some fund balance in that. Now, there was a sort of a policy direction from the council that some of that money should be sent over to the 3PI fund, but the council will have an opportunity to take a look at those sorts of things where there's not a contract in place, but there had been a previous direction to do something. It may be that the events of the time mean that we need to change that direction, because the difference there could be preserving services or preserving jobs or whatever it may be. So those are the sorts of things that Jeff and Denise and their teams are going to be pulling together for your review in the next 2 weeks. And if I could just add one other thing you brought up, it's important on the transit, it's an illustration of something. We talked about the general fund, but Jeff also has to look at the transit fund, the Parks and Preserve Fund, and 2 different police and fire funds that are funded through sales tax. And so when people stop going to bars and restaurants, staying in hotels, and when their stores are closed, there's less sales tax money coming not only for the general fund, but also for transit, parks, fire, and police. And so that's another thing we're going to have to look at in our budgetary analysis as well, because those things that are dependent on sales tax, and there's a lot of them, we have to watch all of those things as well.
Thank you, Mayor.
Thank you. Councilwoman Stark? I'm sorry, was there some, I think I heard Councilwoman Stark?
No, I didn't. I'm sorry.
Wonderful. Any additional council member questions on our financial update? Well, thank you and good luck. And for those of you who just joined us by video, we have council members on the phone as well as in person, so trying to do our part on social distancing. Our next presentation will be on airport operations from Jim Bennett, our aviation director.
Good afternoon, Mayor and members of the council. Thank you for this opportunity to discuss with you the issues that are facing the aviation industry and specifically Sky Harbor today. Before we get into the details of my presentation, I just want to take a moment and acknowledge how upset and saddened we are at Aviation that we lost a dear colleague and a longtime city employee to this virus. And you know, it's difficult for our entire team, and we just want to acknowledge the great service that individual had given us. Allow me to start with this graph. Many of you have seen this chart before in the past, as we've used it to explain the resiliency of the aviation industry and how it has played out at Sky Harbor. So what you're seeing in this chart in the blue line is the passenger activity since about 1951 at Sky Harbor Airport. And then the traffic growth trend line is represented in red. So you can see that over the years, the business at Sky Harbor has seen many shocks to the system, anything from oil embargoes to recessions to wars. But I have to tell you, the trend line has always continued upward. But as you can see by the dashed line that we have there on the right, this will be the most severe shock to the aviation business and Sky Harbor Airport that we have ever experienced. And our current modeling is forecasting that we, in sometime around 2023, should return to our passenger levels that we experienced last year, 2019. That impact that you see on that chart is about you could probably combine all of the impacts in the history of the airport together and not see something as shocking as what we're experiencing right now. And with that 2023 return to 2019 passenger levels, that's a little more conservative than what some of the rating agencies have put forward. I know Fitch Ratings is predicting that in 2022, the industry should return to somewhere around 2019 passenger levels. And as you may recall, last year, we had the busiest year in the history of Sky Harbor Airport with a record 46.3 million passengers. And fiscal year to date through February, we were showing a 3.9% increase over last year. And in fact, in February of 2020, our traffic statistics posted a 6.4% increase over February of 2019. Had we continued that 3.9% growth rate, our passenger traffic in 2020 would have neared or perhaps even exceeded 48 million passengers. But even though we had the best year ever in 2019 and the best February on record for the airport, this is what Sky Harbor looks like today, as the city manager showed you earlier. Even though Sky Harbor looks like this today, yesterday, Sky Harbor was the third busiest airport in the United States. So our business has come to a near virtual standstill in a very short period of time. Now, I just want to show you how quickly this has evolved. This is how quickly traffic has fallen nationwide and at Sky Harbor. So as of March 25th, yesterday, our originating passenger data is measuring about 85% of what it was on the same day last year. Nationwide, it is 90% less than it was the same day last year. So our traffic is approximately 15% of what it was before the COVID impacts on our business. And of course, airport activity and airport revenues are dependent upon passenger activity. So as passenger activity declines, revenues decline. Some examples of that. Our parking revenue is down about a little over 81%. Our transactions, number of people doing business in our parking facilities, is down over 75%. Rental car bus ridership is down 93%. And then our SkyTrain ridership is down nearly 61% from where it was last year. So these are indications for us as to what the impacts are going to be on our economic activity at the airport. And of course, the airlines in Phoenix and elsewhere throughout the world are dramatically reducing their flights or suspending operations entirely. We've lost all of our flights to London. The flights that were supposed to start to Frankfurt, Germany in April have been postponed indefinitely. And all of our Canadian service will be suspended as of March the 28th. We'll still probably have 1 or 2 flights to Mexico for the time being, but those likely will be suspended at some point in the future. And as noted on this slide, at the footnote down there at the bottom, this information changes almost hourly, and there will be further reductions to flights and activity at the airport in April and perhaps even into May. Of course, our concessions partners have seen their business essentially evaporate. Their business is 100% dependent upon passenger activity, and the results have been very painful for those businesses and also the employees that work in those businesses. And based on our most recent information that we've been able to obtain from those concessionaires in the terminals, more than 1,000 of their associates and managers have lost their jobs directly related to the downturn in the activity at the airport. And as the city manager mentioned a moment ago, we do have several capital improvement jobs or programs underway. Now, these investments at the airport are continuing, and they also support over 3,000 jobs. And these are good construction jobs in our community. And these projects are either bond funded or funded with federal grants. And so we're going to continue with these programs because the resources that are funding these capital programs can't be used for other purposes. And also, these investments that we are making here, we will need these investments at the airport when we come out of this downturn in late 2022 or in 2023. And we've taken some aggressive steps in aviation in an attempt to ameliorate some of the impacts from this downturn on our business. We are targeting a 20% reduction in our budget that we're in right now, between now and the end of the fiscal year on our remaining budget. Of course, we have the citywide hiring freeze that is in place, and also we are placing a hold on selective future pay-as-you-go or cash-funded capital investments that we may need. We're going to place a hold on those. And as you can appreciate, airports are busy places, as are our offices. And so we've engaged in a very thorough and intense cleaning and sanitation program for all high-touch areas in our facilities throughout the terminals, as well as in our offices and buildings where our employees are working and stationed. And that program continues, and we will make increases into that program as we deem necessary. And then we're trying to work with all of our airport business partners on what their future looks like. They've all approached us as to how can we help. And what we're working with on our airline partners is through our rates and charges policy is to defer their payments that are due for the next 90 days, defer those payments until June 30th. So they'll have, my words, a kind of a balloon payment on June the 30th of those rents, as hopefully they get back into business and they get some federal assistance also to help with their cash flow. In terms of our concessions, we've been in tentative discussions with our concessions about converting them for 90 days to a percent-only rent environment. That's pending council discussion about that as to whether or not you would concur with something like that. And also, we are awaiting some guidance from the Federal Aviation Administration on that, is that there are some underlying policies that we have to make sure that we're complying with. For the rental car industries, we've agreed with them that we'll do very similar to the airlines, where we will defer that rent until June the 30th. The rental car business has essentially evaporated completely. And then also, we operate a very robust parking business, and we are looking at ways to be able to save money on that parking business, perhaps even closing facilities and consolidating our parking facilities because they're not getting very much usage at this time. Now, if we were looking for a bright spot in this discussion about the impacts on the aviation, U.S. airports are in this current relief package that Congress was approved by the Senate last night, and U.S. airports are scheduled to receive $10 billion in emergency relief funding. And that funding can be used for any purpose for which airport revenues can be lawfully used. So you'll recall that airport revenues have fairly tight restrictions on how they can be used and can only be used for aeronautical purposes. And then the distribution of those revenues are going to be based on some formulas that are currently in place in the airport environment as to how the Federal Aviation Administration administers certain grant programs. And then there's also going to be a piece that will help all of the airports, including Sky Harbor, towards some of their debt service payments as we move forward through this year. So we are looking forward to seeing if the House passes that bill on tomorrow, and then also how quickly that money may be distributed and what that potential impact is to us at Sky Harbor. So with that, Mayor, members of the council, I will attempt to answer any questions you might have.
Wonderful, thank you. And again, want to remind people who are watching, we have Councilwoman Williams, Councilwoman Stark, Councilwoman Pastor, Councilman Waring, and Councilman DeCiccio telephonically. Vice Mayor.
Well, thank you so much for that update. It's important to know what's happening day in and day out. So I see here specifically on concessions, right? And in terms of giving people, giving these companies the relief that they need in order to continue to operate. One of the things that, I don't know if you've thought about this, or is it something that maybe we need to propose? I obviously have some ideas around this. What's the protection for these workers generally at the airport? I know that this is not the first time that we go through something like this. I think it's going to be incredibly important to try to have some sort of retention for workers in general at the airport. I mean, I understand the massive layoffs. I get it. I understand it. But I would like to see us look into some sort of policy or look into some sort of language that we can implement at the airport where we can get worker retention and making sure that we're able to call workers back as business starts picking up, hopefully in the future, making sure that we're able to do that. And in terms of giving these companies some sort of relief, I understand that, and we're partners in the city of Phoenix. We're very grateful that these companies have made the airport thrive, and we're like the most delicious airport, I think we were named at some point, right? So I get it, I understand it, and thanks to all of those businesses and companies that got us that reputation, very grateful for it, but it was the workers that made it happen. So I would like to see us figure a way where we can do something like what Target did or some of these other companies where we're actually paying fully for people's health insurance. I get it that there's some of the companies that are paying their portion of the health insurance, but if workers are laid off, they're not going to be able to pay for that, for their part of the health insurance. So I would like to see if we're going to go into this partnership, how we don't leave these workers out and we make sure that they actually pay for people's health insurance moving forward, if we're going to go into any sort of partnership with them in terms of helping them get through these tough times.
Great.
Thank you.
Thank you. Council members on the phone, any questions? Thank you.
I have a question.
Please go ahead.
Hang on. I have a question. I heard Jim say that they are providing a 90-day relief, or they're thinking about it.
Councilwoman, could you repeat that question? There was some feedback.
Sorry?
Could you repeat your question? I think some of us struggled to hear it due to some feedback issues.
I said I'm asking if I'm getting clarity on what Mr. Bennett said. I wanted to know if he's already agreed to give relief to these companies, or are they requesting it? I need some clarity around that.
Mayor, to Councilwoman Pastor, we're still in conversations with them. There are various provisions in their contracts that they could potentially execute, but we want to make sure that we have a consensus of the council, as well as clearance or clarification from the FAA on some of those reliefs that they're asking for. So at this point, we've not given them any relief at this point.
Okay, so then there's been a request?
Yes, every, Mayor, to Councilwoman Pastor, every business operating at Sky Harbor has asked for some kind of business relief in one way or the other.
Okay, and then my third question is, in this whole process, what relief will these businesses receive from the federal government or the small business?
Mayor, to Councilwoman Pastor, in the package that was approved as it deals specifically with airport, there is no provision in that package for these small businesses or for the concessions or entities operating at the airport other than the airlines.
Okay, thank you.
Mayor?
Councilwoman Williams.
I have a question too. For the small businesses, and I know the Vice Mayor was asking about how we could help employees. Can we legally do anything directly to the employees since they're not ours?
Mayor, to Councilwoman Williams, I maybe would defer to legal or, I mean, we do not have an employee-employer relationship with any of the concession employees.
Okay, then my next question is,
Mayor?
Let's, Councilwoman Williams has the floor.
Answer?
Councilwoman Williams.
Did legal answer? I didn't hear.
Mayor, Councilman Williams, that's something we'll have to do more study on, is what our ability to work directly with contractor employees is. It's pretty limited, but we'll get a more complete answer.
Okay, and if this continues beyond June 30, is there the possibility that it could be waived for another 3 or 6 months, or will that just kill the airport?
Mayor, to Councilwoman Williams, we would not be receptive to anything beyond that 90-day period, because we have agreements with these businesses that they owe these fees, and they're still occupying certain of our facilities, and if they're not going to be able to meet their financial obligations, I don't think we are going to be in a position to extend that beyond those 90 days unless there's a real extreme.
Well, I'm just very concerned that it might continue and that we've gone through a long process. They have struggled through our construction. I would hate to have us have no one out there. And they have provided excellent service and such an asset to the airport that we could surely negotiate some long-term relief, even if it's making it in payments.
Mayor, to Councilwoman Williams, we would have to look at that at that 90-day point. But hopefully by that 90 days, the industry is on the path to recovery.
Let's just hope the feds really come through.
Councilman DeCiccio.
Thank you, Mayor. So, I mean, to answer the Mrs. Guardado's question, I want us to take a look at this. The odds are of us being able to deal directly, and that's a critical word, with contractors' employees is probably not going to be workable. But if there is any relief given, just like any other company that we work with, if there are types of relief given, we can specify in that relief package where those monies are going to go. So I want us to take a look at that as well, just to answer her question more clearly, because I think I know where she's going, and I think we deserve a direct answer on that. If that doesn't work, then what does work is I think we ought to be looking at, because those employees that are there too are also suffering, and the individuals, especially in the food service industry right now, are the lowest and are the hardest hit of this entire problem. And it is something we ought to be looking at, so that if any relief packages are given, we ought to be able to designate how those are going to be done. If they're willing to take the monies, if they're willing to take the relief package, then this is what it's going to look like. And I think we can legally do that. The second thing that I think we need to take into consideration, and I've been talking to individuals throughout, where are we at on this? There is a good estimate out there right now from some of the, the individuals who have multiple tenants. They fully expect 30%, that's as of today, 30% of those individuals that have retail outlets, and the airport would be no different than that, are going to fail. They're not going to make it through. And that is a huge gap in our economy right now. So as we're looking forward, and I'm along with what Zelda Williams was talking about, we ought to be working with these individuals. We need to be working with them, because that's what's happening right now. Landlords throughout are finding ways to extend it out over a year or so, because we ought to be looking at that. These people have been loyal to us. We ought to be looking at ways to work with them, because we know who they are. We worked with them, so it's the individual that we know is going to be better suited to work with us in the future as well. So those are just my comments, Mayor. Thank you.
Thank you, Vice Mayor, and then Councilman Nowakowski.
Mayor, I agree with what Sal DeCiccio was saying. If there's any relief going to these businesses, that they should take care of their workers. I think that what the Vice Mayor was saying is that there's a lot of individuals that work in the airport that aren't city employees, but many people don't realize that. They go in there and they're basically the ambassadors to our city, welcoming people and all that, but they actually are contracted with somebody outside of the city. But saying that, it's what people pursue it as when you walk in there, they think they are city employees. So we want to make sure that if you work at the airport, or if you work at our convention center, if you work in one of our facilities and you have to be a contractor, if we're going to give that contractor a break, that we need to make sure that their workers underneath that business, whatever that is, if it's working in one of our baseball stadiums or working at the convention center or even here at the city hall or at the airport, that they also take care of their employees, because I think that one of the things we're hearing from the employees is that we want to make sure that we have health insurance during these hard times. So if they're good stewards, then we want to make sure that they get rewarded also. Thank you.
Vice Mayor.
So I just wanted to follow up on a question, and I think I asked this at the last policy meeting, is that we were getting phone calls, text messages from people in the aviation department. And I wanted to get an update. Have we been able to get them the wipes, the wipies that they need, the equipment that they need to keep safe? Because it's my understanding that that might still be in the process. And it sounds like they're just still asking for that equipment for protection for the workers.
Mayor, to Councilmember Guardado, we've received some shipments of some of the sanitizers, but we are still, my last information, we're still back ordered on some of the other protective equipment. But for those that need it for a particular response or activity, we do have the equipment available and the supplies available for them.
Well, it just seems like that they still don't have it. That those are the messages that I'm getting, and the conversations that I've had in the last hour is that we have still not facilitated these resources to them. And given that that's where we've had a lot of our issues coming out of, I think it's important that we try to get on that issue as soon as possible.
We will certainly look back into that again. Thank you.
Great, thank you.
Thank you for that update, and please give our best to our aviation employees. We will next go to impact on business, an update from our Community and Economic Development Director, Chris Mackay, as well as our IDA and PCDIC leader, Juan Salgado. And to give Jenny warning, after that, we will do a summary of public comments.
Mayor?
Councilwoman Stark.
Thank you. Sorry. So as just getting seated, maybe at our next meeting, we could talk a little bit about the public process. I know most of the council members have been getting letters from neighborhoods concerned about our public meeting process, and I think it's bigger than just planning and development. Obviously, we're going to be impacted through the budget hearings. Parks holds meetings. I know Streets holds neighborhood meetings on traffic calming. Maybe if we could have a big picture on how we're trying to address those issues at our next council meeting, I sure think that would be helpful.
Okay, I do think that would be an important dialogue. Would it be okay with you if it was either on Monday or Thursday so that we can space out presentations? Okay, our city manager will see how soon we can get all of these ready. But a good suggestion, and it is something we have been hearing from the public about. Chris Mackay.
Mayor, members of the council, thank you for having me here today. With me is Juan Salgado, who is the Chief Executive Officer at the Phoenix Industrial Development Authority and the Executive Director of the Phoenix Community Development Investment Corporation. I always have to get it right in the right line. I'm here today to provide you an update on what's going on with our businesses and to actually end the meeting with some good news. So first, an overview of the market. This pandemic has hit the market harder than anything I've ever seen. I've been through 5 recessions, the dot-com bust, I've been through 9/11, I've been through the Resolution Trust Corporation days, the capital R recession, and nothing's hit the market as deep as we've seen this hit the market. The industries hit the hardest so far: hospitality, restaurants, our retail businesses. But it's not just those sectors. There's a number of sector businesses that support those industries, whether they're in linen services, whether they're in work that does work at our restaurant or our hotels or provides some services. So it's really rippling through all of the industries. But as we're working with our businesses, other industries are pivoting. They're learning that they may not be able to manufacture, there's not a need for what they manufacture today, but we're working closely with them to help them pivot and use their workforce and their buildings and their products to manufacture something else in demand. We've had great conversations with our projects under construction. They're still continuing to push through construction, and they plan to move forward, and they're continuing to draw down and continuing to employ their workforce. Just by the nature of what they do, practicing social distancing is much easier for them. Some quick industry updates. We have frequent communication with our grocery stores and our wholesale retailers, and are working with them on supply chains, on their workforce, and things that they need with their customers. On hospitality and event venues, as we know, they've been decimated more than any other industry. We have hotels that would normally at this time of year be at an 85 to 110% of bookings. They're either in the single digits or they've closed. So like nothing we've ever seen before. Our restaurants and retail, restaurants are operating in a takeout manner only. We've been helping them in finding to-go containers and materials to be able to shift their business into that manner. But manufacturing, as I said, and construction and some other industries are really pivoting and starting to work well in other areas. As I've briefed most of you on, we are doing employer outreach. And so my team members, last week, we completely shifted everything that they did and started focusing on their outreach to 18,000 employers here in Phoenix. And they're making contact and they're getting good feedback and they're able to provide resources and connect them to resources available and help them through the challenges that they're facing, whether it's their furloughed employees and helping them find other jobs or whether it's helping them find products available. Our resources are available on our website, and at the end of this presentation, we'll have it up on the screen so anyone who's interested can easily focus on that. As another example, we're connecting people with the Small Business Administration. There are businesses and loans that are available through the SBA, but what we've heard from a number of you and from a number of those businesses is that website is incredibly challenging to navigate. There's confusion on the forms. The forms they're using are predominantly used for disaster recovery in issues of hurricanes or tornadoes, and the fields don't really fit what they're looking for. And so we met with the SBA. We found out exactly what needed to be done. Our team has produced a video that we'll post this evening in both English and Spanish that walks our companies very easily through how to fill the forms out and what to do ahead of time and the information they need ahead of time. We also brought all of the forms down onto our website so they don't have to search the web for the 5219 or any of those. And we created a flow chart so every type of business knows exactly the forms they need to put up. We're also working directly with that workforce that's affected by our hospitality, by our restaurants, by our retail that's out there in helping them connect in the places that there are jobs and connecting those organizations that have large amounts of a furloughed workforce find those jobs. And we're posting those connections on our website, providing assistance with resumes and applications and other services and assistance that they might need, how they fill out unemployment, those type of things, working closely with Marshall Franklin's team in human services. I'm going to turn it over to Mr. Salgado now to end us on a very positive note and some assistance that he is able to provide us for our small businesses. Juan?
Good afternoon, Mayor and Council members. On behalf of the Board of Directors for the Phoenix IDA and the Phoenix Development and Investment Corporation, who is also known as PCDIC, thank you very much for the opportunity to join you this afternoon. Under the leadership of Mr. David Lujan, who's chairman of the Phoenix IDA, and Mr. Milton Duhoney, who is chairman of the PCDIC, both board of directors convened 2 weeks ago to discuss resources to assist small businesses and small nonprofit organizations impacted by the pandemic. After much discussion, action was taken to allocate $2 million from each organization to provide financial support in the form of grants or microloans. After the allocations were made, we were directed to identify those areas where we could assist that were both in compliance and identify those businesses that were most in need. Before I begin my comments regarding our response or our support, I'd like to acknowledge and thank the following companies for assisting in the development of these financial resources. First, the Arizona Community Foundation, the Business Development Finance Corporation, Mutual of Omaha Bank, City of Phoenix, and a special thanks to the dedicated Phoenix ID employees who have been working late hours and weekends to put this product together. Mayor and council members, I have provided you a packet of information that you were shared before. If I may ask you to turn to the first page before I get to the presentation. I wanted to share with you at least a summary of what the IDA and PCIC Board of Directors has allocated. Now, we have received preliminary approval to start moving forward and identifying those areas, and so we're not ready to roll out programs. We're still kind of finalizing some items, but I was asked to come and make a presentation to you today to give you an update on where we are. In regards to the Phoenix IDA, we have provided $100,000 to support the Arizona Community Foundation COVID-19 Community Response Fund to be distributed to nonprofit organizations that swiftly to conditions and circumstances it needs to change throughout the crisis. We've also committed $2 million in partnership with the City of Phoenix to offer grants and operating costs to local small businesses to help quickly mitigate the economic distress and sudden loss of revenue. And then we are also working with existing loans that we have with the Arizona Community Foundation that mostly consist of nonprofit organizations, and we're looking at deferring payments so we can assist them along that. We also are working with some businesses at the airport. I think that item came up earlier. We're working with our lead lender to assess the problem. If we need to restructure our debt to provide deferment of payments, we will also do that in that process. As far as PCDIC, and a lot of these initiatives kind of mirror each other, so I'll try not to overlap what both of us are doing jointly. So PCDIC's board has allocated $1.1 million to support the Arizona Community Foundation. They've also provided $2 million as initial funding for the Small Business Recovery Loan Fund, which will be administered by the Business Development Finance Corporation. Got it. Thank you. I'm not used to doing this. I'm a retired city employee, so it's been a while. And then, like the Phoenix IDA, many of these initiatives or loans that we have are jointly done, so we're working together again to assist businesses where we are. So with that, let me start out by moving this. The first initiative I want to talk to you a little about is the Small Business Grant Fund. As I mentioned earlier, $2 million in grant funding for up to $10,000 per qualified businesses. Now, as we identified criteria and qualifications for the businesses, one of the things that was key is that we help those most in need. And so, obviously, the first one is qualified census tracts. And that packet that I shared with you is a map of where those qualified census tracts are, so you at least get some idea in terms of the geographies that will be impacted by that. The next is that we're focusing on minority-owned businesses, small businesses with 25 or less employees, no more than $3 million in taxable receipts, and physically established here in the city of Phoenix, and we're also including mobile food vendors. Part of the criteria is that they need to identify the loss of income due to the COVID-19 to receive the assistance. So I think we went to, am I going backwards here? All right, so the money that will be received is to support working capital, to support payroll, rent, mortgage, and utilities, and other operating expenses. We currently are working through the application process on how the money will be distributed. As I mentioned, we've been trying to work quickly to get to the point where we are. We know there's urgency out in the community to respond quickly. So we're hoping to have in place by the first week of April, where we'll announce the program and the process, and then shortly, within the next week or 10 days, we are distributing funds. So we will keep you informed as to the progress. So moving on to the other one, this is a PCDIC's allocation of $2 million to help support small businesses. We have partnered with a local SBA lender called the Phoenix the Business Development Finance Corporation, also known as PDFC. So they are primarily a 7A lender that focuses on small business loan. In this particular initiative, we are targeting same qualified census tracts, focusing on minority-owned businesses, same criteria as the other on the employees and on the taxable revenues. In this particular case, because people will be applying for loans, we're looking for 2 years of existence in business, and then again, same thing of loss of income for the COVID situation. Now, let me talk to you a little bit about the terms that are included in this program. The first one is a 10-year term. Interest income is prime plus 2 3/4. The prime is basically the index that SBA uses, and then the margin at 2.75 is what's being used by SBDC, and interest only for the first 6 months. If you equate that, that's about $125 a monthly payment on a $25,000 loan. And if you amortize the balance of it at 9.5 years of principal interest payments, we're looking at about $290 per month on the same size loan. No prepayment penalties, which is the issue with a lot of small businesses loans that occur in the early stages. No collateral is required. And that pretty much concludes our presentation of small business. Now, we are watching the legislation very closely, and obviously as soon as it's released and we get more detail, we want to make sure that we take full benefit of the SBA, especially as it's providing services for small businesses in that $25,000 or so range. So with that pretty much concludes my presentation, and I'll be ready to answer any questions that you may have.
Thank you. Always good to have good news. Councilmember Garcia.
Thank you, Juan, and thank you for moving so quickly on this. With these numbers, you'll be able to help 200 businesses. Do you think this will go quickly? Do you think this is enough? Or is there other places where you're looking to grow this, or partners, or trying to make it, maybe asking others to match it?
Yes, the amount that's described is a huge investment for 2 small organizations. And as we have, under the leadership of our board of directors, we're always out in front to essentially set up the initiatives. And at this point, we're creating new structures. And I think once the structures are in place and the programs are working, it shouldn't be difficult to raise money. The case always is who's going to be the first out. And so I'm proud to work for an organization that is always prepared to lead in particular times of crisis.
Councilman Nowakowski.
Well, Mayor, first of all, I just really want to thank both of you, our CD director, for her outreach. I think it's really important that we were reaching out from day one. A lot of the businesses were saying that they've gotten calls from you all and that we were out there trying to help, but at the same time, they were trying to help other businesses. So that was so incredible. And I think that's that whole Team Phoenix approach where we reach out and then we end up getting help also. So, thank you, Chris, and thank you for all your employees that are on the phone on a daily basis. I know some of them are working very hard and making sure that all the businesses are getting whatever they need. And then the SBA, that's something so important. There's so many businesses out there that really don't know the advantage that they can take from all these different grants that are going to be available for them. But then one of the concerns that we had, I met with some of my colleagues, is especially the small mom and pops, the individuals that don't even know that there is these grants or these loans that are out there and that they can apply to them. So one of the things that we asked is if you can create a video, and you've already done that, so thank you so much. Also, I know that we asked you if there's some stuff in Spanish. You sent out some material to us. We translated it, and now we have flyers that are available for small businesses to try to learn. The other big thing is that we had businesses out there that needed employees. And basically what we did is we created sort of our little job fair, but at the same time helping the most needy that probably didn't even know how to fill out a resume or an application and all that, and we're there helping them out. So I want to thank you and your staff for just really reaching out and helping those that really want to go out there and that has a need to work, and at the same time we're filling out some applications and helping them create a resume for themselves. But John, Mr. Salgado, what you guys are doing is incredible, coming up with $2 million, and I think that it's time for us also as the city of Phoenix to either try to figure out a way to match that or so, and then to call some of our businesses that are out there to basically help us out with that small loan. These are loans that people that are struggling really need, people that have no idea of how they're going to survive from one day to the next. I know that we have a lot of good corporate sponsorships out there, so if there's anything that I can do, and I'm pretty sure my colleagues, to help call those individuals and maybe put a little pressure for them to come in and help us out. I know that other cities like Los Angeles has a little over $10 million, and for us to come up with $2 million just like that, I believe we can get up to that maybe 5 or 6 million that our city really needs. And if there's anything we can do and any ideas, let us know. And once again, thank you, thank you, thank you.
Vice Mayor.
Yes, again, thank you so much, Juan, for all of this relief and all the help that you're giving us. Thank you for the presentation and responding so quickly, right? I mean, we have so many small businesses out there that were probably already hurting, and now with their businesses being closed, these are really tough times. So thank you so much for your leadership in all of this. Chris, once again, thank you for all the work that you're doing and everything that you're doing for the city, and responding so quickly to this crisis. Thank you for all the work that you do day in and day out. But I just wanted to follow up on a conversation that you and I had a few days ago. How is it that we're coordinating all the different departments, especially in the industries that are being hit the most right now? Like, how are we coordinating our airport workers? Are we able to connect them with the grocery stores? Especially, like, we have a lot of workers at the airport that worked at the airport for over probably 20 years that are now being laid off. And I know that there's a lot of these workers that probably don't even know how to fill out a new application for a new employer, and they've been at the airport for such a long time. I know that there's language barriers that these workers need to surpass in order to be able to fill out an application. So is there a way where we can coordinate specifically with the airport workers and maybe even the hospitality industry? I know hospitality industry, those workers have also been there, for over 20 years. How is it that we're coordinating, or how can we as a council be helpful to help coordinate that?
Mayor, Vice Mayor Guardado, that's an excellent point. You've got this workforce that's out there in industries that are particularly hard hit. We're coordinating with our Human Services Department and our Arizona at Work colleagues across the entire state of Arizona with the state, but we are doing direct outreach to those individual groups, but we've not reached out to the airport. So we're going to coordinate with that immediately. We'll work through those organizations and do that outreach to them so we can help them with those jobs that are available. One that we had most recently, there were bus drivers that had lost their jobs, and we were able to get them connected with our grocery stores. They had CDLs, so commercial driver's licenses, and we were able to connect them with our grocery stores to do relief on driving trucks. So we'll reach out immediately to the group that's handling the airport and make sure that we're connected, that they know of our resources, and the same on the hospitality side.
Great, thank you. And given the presentations, after Jim's presentation, after Jeff's presentation, I know that we have to make very difficult decisions in the next coming months, but I think it's a critical time that we all do everything that we can to support our small businesses that are the backbone of our communities and are the ones that are being hit the most and are being hit first. And I would like to see, I would like to direct our city manager and our finance manager to be able to look at potential funding to match up to $5 million from our non-city entities to provide much needed relief to these companies. I realize our budget is tight, but relief is needed to manage the situation that we have in front of us today, and I would love to urge the city and urge our city manager to try to figure out how we can match this. Supporting what Councilmember Nowakowski said, like I think we are gonna need more than what's out there right now as layoffs continue, and if we can look into that and see if we're ever able to match that.
Mayor, Vice Mayor Guardado, we can certainly identify funds that might be usable for that. Just my caution on that, and again, the council will make the decision. My caution on that is every dollar that we spend now is a dollar we have less to deal with our own city budgetary issues that we know are coming our way. You will want to make that decision knowing the trade-off that you're making, right? So that let's say, for example, we take $5 million to do that now. In 2 months, and when we're facing whatever we have with our budget, that would mean we would have $5 million less to perhaps deal with parks and libraries and other services. But again, those trade-offs are ones that the council would have to make. We will just provide you the best information we can about what that trade-off would be.
Great, thank you.
Council members on the phone, any? Wonderful. Well, thank you for your hard work to support our businesses during this incredibly difficult time.
Mayor, thank you. And just for the people who are looking at the screen, all the information that they need is at phoenix.gov/resources. And that's where our videos will be posted. That's where all the information about the city's resources are posted.
Thank you. Our final portion of this meeting, we have received comments from the public and would ask our staff if you could briefly summarize those comments and then make the full text available to all council members.
Good afternoon, Mayor and Council. There were 7 comments submitted by the public for today's meeting. Common themes included asking the council to ensure stores have adequate supplies, encouraging the council to take further action to achieve proper social distancing, and identify additional ways the city can provide financial support to businesses and individuals.
Wonderful. Thank you. With that, we are adjourned.